eviCore Healthcare's educational webinar series. My name is Bill Cornelius, and I'm moderator for today's event. eviCore is a company that empowers the improvement of care by connecting patients, providers, and health plans with intelligent, evidence-based solutions to enable better outcomes. If you would like to learn more about eviCore and how we enable better outcomes for patients, providers, and health plans, please reach out to sales@evicore.com for more information. Throughout 2021, eviCore will be hosting free educational webinars that include guest speakers, as well as eviCore subject matter experts to discuss today's most pressing healthcare topics. Stay tuned for our future webinars with new topics presented each month. And now it is my privilege to introduce to you our panelists, Dr. Cynthia Zelis, Chief Medical Officer from MD Live, and Dr. Mayank Shah, Chief Medical Officer from eviCore, as they discuss the influence of the pandemic on the growth of telemedicine. They will also look at some effective measures for disarming some of the common fears, risks, or limitations you may encounter in the marketplace. Before we begin, just a quick reminder to please submit your questions using the question option within WebEx. This presentation will be recorded and it will be available on demand located on the Insights page at evicore.com. Take it away, Dr. Zelis and Dr. Shah.
Thank you so much, Bill, and thank you everyone for joining us today to talk about an important topic impacting us in healthcare. I'm very fortunate, we are all fortunate to have Dr. Cynthia Zelis join us from MD Live to talk to us about the impact of telemedicine in today's world and what can we look forward to going forward. So excited about this topic. Dr. Zelis, as we start, can you please take a few moments to introduce yourself and talk about the company you represent today, MD Live.
Thanks, Dr. Shah. And again, my honor to be here speaking with you all as this is such an important conversation as we're just really transforming and changing the way we're delivering healthcare. As you and I as physicians, as we were trained back in the day, life is certainly different. And so I am a board certified family physician, been in practice for 50 years, evolved in through leaderships, and have been with MD Live as their chief medical officer for just over about a year, but have been with telemedicine itself in my previous work at University Hospitals of Cleveland. And what a time to join a telemedicine company. MD Live itself is been around actually for over 10 years. So we know telemedicine is not new, serving multiple products from virtual urgent care, behavioral health, primary care, as well as virtual dermatology. And we really focus on, MD Live focuses on what we call taking care of the 4 C's, the best type of care, making things cost reduction, making things convenience, and now more than ever, contagion avoidance.
Wonderful. Thank you so much for joining us today as we dive into our topics. Before we go on, I wanted to give you a little bit of introduction about us in eviCore. So my name is Mayank Shah. I serve as the Chief Medical Officer for eviCore. eviCore is a home-based primary care practice that is out of the eviCore line of business. And it's been fortunate, like you said, I think we're going through an amazing transformation in healthcare, and really access to healthcare is so convenient for so many of our members. And I think it's wonderful to see this journey. I'm also a family physician by trade, by training, so aligned with you there. And it's been a passion of mine to look at how technology can really enhance and improve quality of care. So it's wonderful to talk to you about these topics. Today, our objective will be threefold. We're going to talk about telemedicine and telehealth in general. There's a lot of confusion about terms, so we're going to try to sort it out for you. We're also going to talk about, obviously, the biggest thing on our mind when it comes to telemedicine is what impact has the pandemic had? Where do we see the future going for telemedicine? And the last and the most important topic relevant to us today is really talking about what are some key barriers to telemedicine and adoption of telemedicine, as well as what are some future strategies, how we can overcome these barriers. So we have a pretty agenda, and we're going to dive right in. So as we start, Dr. Zelis, the first question I have for you is that we have seen a lot of terms being used in the market out there. We've used telehealth, telemedicine, digital health. Can you break this down for us and help us understand telemedicine versus telehealth?
Yeah, and you're right. I mean, it certainly is a whole new language, and I think we have to think about, how other aspects of our life has changed from a language we never used the word, app 20 years ago, let alone mobile things. And I would say, and I think we know, healthcare itself is a little bit behind everything else that's gone digital. And so, what is the digital terms that we use now to describe telemedicine? And if we go big picture to small, digital health is that big picture. It's that delivery of healthcare across hardware, software, artificial intelligence, mobile, smart device. But then as we get down granular, telehealth is, how do we do remote patient monitoring? But what we're going to talk about is that it's not very granular anymore, is that telemedicine, where there's actually direct healthcare being delivered as patients are connecting with providers are connecting to providers, whether it's synchronous or asynchronous. So telemedicine is just a subset of the big digital picture that we have. And, we could talk probably for a long time about the whole picture, but I know we're going to focus on telemedicine. But Dr. Shaw, I know, in Allegis, you have embraced a lot of aspects of the full continuum of digital health. And so your example of those three things that I just went through, digital health, telehealth, and telemedicine, maybe it'd be great to hear what you share, how you're living those kind of three definitions too. Give some color.
Doug, yes. So, a great question, and something that we have been very mindful of. And like you said, I think the telemedicine journey is not new, right? A lot of organizations have been on this pathway to think about how to embrace technology and digital health in general into our care delivery model. And Allegis has not been an exception. We've been really focused on that. The pandemic has certainly accelerated our pathway. When we think about the core primary care, though, there are three buckets that we identify our services into. We have prevention, which is kind of the main work of what primary care teams do. We have chronic conditions management, and then acute episodic care. From a primary care perspective, these are usually the three buckets of care provision that we deliver within our care model. When we think about digital health, we really are motivated by a lot of transformational changes that technology, telemedicine, and telehealth can bring to the model. Obviously, it can create a differentiator in the marketplace. It can create a consumer experience and a consumer focus that we haven't really had very much in the healthcare world. It allows us to create more efficiency in the delivery of the care model. Our model is based on face-to-face visits in the home setting. And how do we create efficiency in that? By delivering either efficiency of the care delivery, accessing, creating scalability so we can reach more and more patients through our services and the impact that we create. And then also, support clinical integration, a way to coordinate the teamwork that we do that drives some of the key outcomes that we look for in the market. So these are all some of the reasons why we were embarking on this journey of transformation and looking at adapting, telemedicine, telehealth. As I think about that as practical level, what are the key elements that we're looking for in primary care to implement to support us with these goals in mind? Obviously, video visits, e-visits, and telespecialty visits, which fall into that scope of telemedicine services. We think about remote patient monitoring or continuous monitoring as overall telehealth strategy, and then smart device integration, mobile health apps that are populating out there and creating an effective way to coordinate that with two goals in mind. The primary goal is creating a seamless experience for our patients that we serve, and then also creating data integration strategy to make sure that it's not a standalone solution or something that is going to create excessive effort to gather data and put the whole picture together. So in our mind, this is the framework we have created and we have followed over the last couple of years to kind of create a roadmap of where we want to be and where we think we should go in terms of our digital health picture. But great question, and I think there's a lot to be learned as we evolve and as there's new innovation that comes in the market that helps us drive this forward. So it's pretty exciting to talk about this. So
yeah, Dr. Shaw, one of the things before we even get to that, I wanted to just point out, just you and I as family medicine physicians, if you go back there, I mean, this is going back to digital health and telehealth. If we really put a lens to it, it's going back to the more personal predictive, more personal healthcare we used to have in those home visits that we used to
Yes.
do, but with the advances of technology for predictability. And so it's I love to see how you've been doing it at Allegis, and we've adopted some of the same things with MD Live. So that's the great stuff. Great stuff. Thanks.
Yeah, and Dr. Zelas, when I think about this, you know, what motivated Allegis Care, which was started care, one of the key issues that we were trying to address is the opportunity cost related to access to care. So we had this study in our office to look at what happens when a patient is actually scheduling a visit to go see a doctor, right? And what we found out is it takes about 3.5 to 4 hours of time frame from prepping for the visit, scheduling the appointment, to traveling to the clinic, waiting in the waiting room, seeing the doctor, getting your labs done, getting your prescriptions, going back home, and then following up on those results. That entire package of services is roughly 4.5 hours of an opportunity cost. And so if you think about it, when you have a chronic condition with multiple doctors you're involved with, multiple visits you need to do, it's a significant amount of opportunity cost that we burden our patients and our customers to go through in order to access care. And our goal is to really tackle that with home-based care as first piece, but I think that the more exciting thing for us to talk about is how telemedicine is really revolutionizing and addressing these opportunity costs in a such more dramatic and convenient way, like you pointed out. So I know we wanted to talk about telemedicine and focus on that today. So Dr. Zelas, I do have another question for you. One of the key things that's happened is obviously with the pandemic, we've seen a transformation in the adoption and the ability to utilize telemedicine. So can you recap for us like the impact of the pandemic and as well as where telemedicine is kind of moving in our market today?
Sure. And yes, I mean, with all the pains and sorrows that the pandemic has given us, it has also given us kind of a silver lining. And where we think of with telemedicine, you know, the pandemic has given us what we would call a forced trial of telemedicine. You know, telemedicine is not new, but barriers that we're going to talk about later to adoption telemedicine, such as regulation, consumer adoption, provider adoption, and technology improvements, those things in and of itself have been broken down. And so you can see here, I mean, these are some basic facts, and I'll share what we're doing. The growth has been incredible. And what I want to point out, which I think is really important, particularly with some of the, you know, as a physician myself and my spouse actually being a provider in an in-person practice, is, you know, telemedicine is not meant to be additive. It's often meant to be substitutive and complementary to in-person care. And so what we saw is, you know, in-person, you saw in March and April, had a significant drop. Now, it would seem by those numbers, the 100% growth, 1,000% growth, and 4,000, that perhaps it was replacing. You know, again, it is, telemedicine itself is meant as a complement. It's certainly not meant as additive to in-person. We don't want to duplicate costs, but we all know there are things that can be taken care of virtually. And this is where telemedicine can be incorporated in a practice. At MD Live, you know, there are things that will allow for the convenience and the high quality of care that we can deliver virtually, so that in-person can be focused on those aspects of, you know, high intense care that needs to be done in an in-person setting. But you can see just by these facts, the forced trial of our pandemic has created huge adoption in both service growth as well as coverage from beneficiaries, as well as kind of telemedicine as a skill set. I mean, I'm thinking about these. I don't know if you've had any conversations with your medical school, and I'm on the alumni board, and they are learning differently now. Medical school has forced, you know, the pandemic to learn differently. So certainly our physician educators of the future will be used to this virtual. So we need to be comfortable in adopting telemedicine. So that's some of the high level stuff.
No, great points, Dr. Zelas, and something we have also experienced in our practice, right? We had this intense fear that we serve some of the most sickest and obviously the elderly patients under Medicare Advantage that, you know, are homebound or really don't have access to, you know, great resources. And we were worried that the telemedicine would be such a burden to create access and a technology barrier. And we've been pleasantly surprised. You know, 75% of our patients have been able to take us up on being able to connect with them through this telemedicine platform, and it continues to grow every day. And in fact, what we're finding is 95% of those that we connected with are actually want us to connect with them again on the telemedicine platforms. So, you know, you're highlighting a very important trend that we're beginning to see. Technology has improved so much over the last decade in terms of our ability to video communicate with each other. And then the comfort level of the general public has gotten so great with platforms like, you know, our FaceTime and Google Duo and so many Zoom that, you know, we feel pretty comfortable in using this platform for communication. And so I think all of that is certainly has accelerated. You know, some of the key stats that we've seen is that 9 million Medicare beneficiaries have received telehealth services during this public health emergency, which is remarkable. And this is just from March to mid-June within that time frame. You know, so a population that we thought would have the hardest time, we've seen a significant advancement, you know, kind of dispelled our stereotype that we had that we really couldn't reach these members through these platforms, that they were more for the younger patients or the younger population or the millennials, right? And we've been proven wrong, you know, through this pandemic for sure.
And I can share with you before we get, you know, we cover, MD Live covers many Medicare Advantage plans, and we've seen very similar to you growth and adoption in our Medicare. So, you know, telemedicine has no age limits along that line. So, you know, and we have, and you can see, and kind of if you flip to the next slide, you know, we've been blessed as a business, but more blessed to me as a clinician and our 2,000 providers to really feel like we are delivering healthcare, to your point, where patients often haven't had that healthcare before. So, you know, we've had a tremendous growth. You see there 84% in virtual visits in overall growth, and that includes our behavioral health. There's lots of stats here, but here are some of the ones that I'm really, really proud of. So one, I would say we've had over a 500% growth in our behavioral health. And Dr. Shaw, you and I can probably agree that behavioral health is that is it the chicken or the egg when it comes to chronic care conditions? And so we need to deal with behavioral health. So where behavioral health has had such an access issue, you know, telebehavioral health, particularly here in MD Live, we've been so proud of that growth, being able to reach people and also avoid those high costs, such as emergency rooms that, you know, they may have had they not been able to access other services. And the other thing I'm extremely proud of, particularly with some people who, physicians, primary care physicians that may have, you know, concerns of, you know, territory. And again, that balance we want to have about being partners in caring for patients. So 1 in 4 of our MD Live members have virtual primary care advantage. Again, meant to be complementary. But what I will tell you is our wellness that we've launched out that I'm so proud of, 54% of them don't have an identified primary care provider. So again, we're providing access for a service, wellness, which we all know is so important from a family medicine approach of identifying preventive care service, which ultimately will lower the total cost of care and really help things. So, you know, MD Live's so proud to be a partner. And those are some of the things that we're really, really just proud of, and, you know, pleased a little bit about the pandemic to get that adoptions, because it's allowing us to make an impact sooner.
No, great point, Dr. Zelas. And I think something that we can't lose sight of as we navigate through post-pandemic era and really think about how do we continue to move forward with the progress that we've made, you know, over the last 15 months. And I'm very excited to, you know, see that future for us going forward. Let's talk about the main point of our discussion today, which is really addressing the telehealth barriers and opportunities. So Dr. Zelas, from the industry perspective, what do you see as the big barriers to adoption of telemedicine today, and some ways that we can deploy to overcome those barriers?
Yeah, and I'm looking forward to kind of going back and forth, but, you know, very much there are 4 key kind of areas that I would really talk about. It's, you know, our consumers, right? It's the technology. It is about our providers on the other side of the screens, our physicians, you know, and I would say legislation and plan adoption, right? So we've got regulatory barriers, and we want to make sure those get, you know, overcome. We have plan and provider issues, consumers, as well as technology issues. So those are the 4 categories. I'd like to talk, I'll talk first about consumers, because we're very driven to, you know, again, have a consumer focus. As many as are, we want the highest patient experience. And what I really think is important related to the consumer is our studies have shown that people want to use telemedicine now, very much like you spoke to earlier, is they want to come back. So 68% of our consumers intend to use it. So telemedicine from the consumer standpoint is really here to stay. And so many of those consumer barriers have been kind of fought through this pandemic. There are questions amongst our consumers that we've seen is, how do we know that the quality is the same, and how do we know my plan covers it? And I would say one of the ways, at least at MD Live, is, we measure ourselves by the same metrics as any type of providers. Our HEDIS scores, our time to available, documentation. And so continuing to measure quality will be real important in continued consumer adoption. Dr. Shaw, what's your experience with your patients wanting telemedicine?
Great points, Dr. Zelas, and I completely agree with you. I think the pandemic and our focus, the biggest thing that I really enjoy about what telemedicine has brought in the pandemic is our focus on the consumers, right? On their experience, which up till now, like I mentioned, I think it's been one of those neglected corners in healthcare. We measure patient satisfaction, or we measure that, and we're satisfied with those metrics and say, hey, we have this. But we haven't really truly talked about what is their experience like? What is the journey like of going through healthcare? And I think the telemedicine, the focus on their experience, the ease of use, adoption, how can we make this better? And I think combine that with some of the work being done around social determinants of health, and like you pointed out, access to care being the primary barrier to overcome, to even think about population health strategy. I think it's been phenomenal to see that progress accelerate over the last year. And pandemic not only highlighted the need for improving access to care, but delivering the much needed medical care to, a segment of population that's perhaps at the highest risk, or could really, have such lethal consequences of not having access to care. So I think all of that for us became really catalyst in moving forward and thinking creatively, innovating in this space, and thinking about how do we focus on that consumer experience, and then challenging our beliefs, our stereotypes, right? We think, oh, this segment of population should never get this or will not adapt this, and then saying, well, how can you make it better? What can we try? What can we do? And really coming up with those creative solutions has been some of the great adventures, and personally things that I've enjoyed over the past year and a half, for sure.
Yeah, and I would agree. I mean, I think that leads into the other thing is we've got to be innovative when it comes to, the technology and moving things forward. We have to think outside the norm. And, again, thinking about other industries, right? We may not have adopted online banking, so quickly, but now who goes into the bank anymore? And so, that speed to delivery. And so when we think about technology, I think, particularly for our physician colleagues, many of us started with the infamous EMR, which perhaps might not have been the easiest technology, but technology does make things easier, to make things more predictable and improve kind of the quality delivery of care. And so as we think about technology being one of the barriers to adoption in telehealth, we need technology to be seamless for both the patients as well as the providers. We need it integrated, because the last thing we want telemedicine is to be its own silo. It needs to be integrated so there's a full patient care experience. And we have to be comfortable with new technologies, remote patient monitoring, and that ability to, measure right at the point. That's going to change healthcare. No more will we'll wait for them to bring in their, piece of paper with their blood pressures for the last 8 months, right? And 2 months ago it went high, and we could have made an impact. And so, technology in and of itself, while a barrier, is a huge opportunity that we just have to be ready to embrace. And that's where I'm thinking, as we continue generationally, more and more people will adopt too.
I completely agree with you. And I think we're already seeing some of the key innovations in this area about how technology can be even made better going forward. And I think there are two buckets of key innovation that I see emerging out of this, right? One is what you mentioned already about the platforms themselves, technology, integrating, data integration. The other is the creative aspect of what we bring to the table as providers, right? In really thinking about the mode of care delivery that we provide. So from a primary care perspective, I can tell you that this is something that our team constantly thinks about. Says, okay, what can be delivered through telemedicine platform? Yes, there's limitations. I can't put my hands on the patient, through the telemedicine platform, but there are things that I can do to gather the information that I need. And that creativity, that innovation, I see evolving, which is amazing to see as part of energy and part of what we need to continue to do going forward. So great points, Dr. Zelas. I appreciate it. Any comment on the legislation piece and where that seems to be going? Do you anticipate that post-pandemic we're going to continue to see some of the changes that have been made to facilitate adoption of telemedicine?
As I think about the regulatory standpoint, and I served on the national committee to help make some recommendations back in 2020, there are probably a couple areas that we need to bucket them in. And I would say first is the main question of payment parity. That's the big question that's out there, and to fight that we have to determine that it is of equal quality to in-person. The second certainly is what's out there related to fraud, and is telemedicine actually advancing Medicare medical fraud, or is it just really same medical fraud? So it's really not telemedicine itself. And then third, I think, is really the adoption and the continued acceptance across Medicare related to their coverage of it. As we knew prior to the pandemic, the Medicare regulatory requirements to do telemedicine is, a person had to be in a rural area and still go into a clinic in a rural area by which to deliver telemedicine. So, the actual guidelines of how telemedicine is delivered, payment parity, as well as kind of demystifying any aspects of concerning of fraud, those are going to be extremely important as we try to continue this wave of transformation of healthcare through telemedicine. How about you? Where have you been, particularly impacted in aspect of legislation that you can remember?
I think one of the key aspects that we have really appreciated is the liberation of the licensing requirement by state level. And I think that's been a huge lift to think about how we can deliver care more broadly and really meet the need of the different markets out there. And so very excited to see, how there's a lot of moment, and I see a lot of buzz going around in the healthcare market talking about making that stick for the long term, which I think will be very important as we go forward and think about how do we continue to create a better provider experience when it comes to delivering telehealth and telemedicine, and allow the reach to go beyond their current geography to really leverage this into rural communities and areas where physician access is such a difficult thing to do in many of our country, across the country. And I think accelerating that through this pathway seems like a viable opportunity going forward. So very excited about that approach,
If I could just comment, in at MD Live, we have a lot of providers who work with us, and they have multiple licenses. I myself, and you're right, the bureaucracy and the stuff to get a license, and this is actually where our clinical partners in care nursing have actually led the way with this concept of a compact license. Right. And so I think, if we want to provide good health care, we should have some standard requirements that are national. And, I look forward to seeing, how that will look as we evolve, and perhaps, a concept of a compact or something to make that state licensure easier.
Absolutely. Speaking of which, the last bucket that we wanted to talk about are some of the provider barriers. Yes. So any comment on that, Dr. Zelas, in terms of what are some key barriers you see from a provider adoption perspective of telemedicine? We know that's grown significantly through the pandemic, and a lot of providers had pivoted towards, deploying telemedicine tools in their practice and delivering care in that manner. But any insight you have from MD Live experience in terms of provider adoption of telemedicine?
Yeah, I'm fortunate, the group that we have of over 2,000 providers, they want to do telemedicine, so they're looking for doing things innovatively. But yet I would say in some part, it does go back to the core of what we learned in medical school, where listening often provides the diagnosis 80% of the time. And so telemedicine, really aligns kind of what I would call the art and science, right? And, this is a study I'm looking here back from 2018 that identifies some of the barriers for, providers or physician adoptions, which I think are some of the things even the consumer, it says potential medical errors, but what that's really talking about is how can we ensure we're doing the same quality, right? And so that, that's where we want to speak the same language and it, MB Live, again, as I mentioned, kind of HEDIS, same type of metrics. We also, one of the things related to minimizing medical errors and the benefit of telemedicine is the fact that, documentation and, encounters we can use artificial intelligence to understand things more versus sometimes if we think about it in brick and mortar, those are, it's whatever you write down, right? And telemedicine can actually capture some of those things to really understand in healthcare. One of the things, and this is where I would say we've probably significantly changed since the pandemic and this study, we know that workplaces are offering this that was identified before. So telemedicine is being offered. And then security and privacy of patient information. This is probably one of the benefits we have of being an industry that has lagged in its digital transformation because security and technology has gotten so much better in that area. So, from a provider standpoint, I think there's certainly, from a physician, there's some personal territory. How is this going to impact me, right? There's some basic cost. How am I going to run my business through both things? And then 3, back to the core of, will I be able to have the same relationship and the highest quality that I've delivered? Those are some of that we've seen. But I think as we continue to advance, we're going to break down those barriers. Have your peers been open to this, or what are some of the things they've found that have been barriers to adoption?
So I can tell you that it's about any other change management in healthcare, right? When you pivot to a new model of care delivery, you always get initial resistance at first. People have their own kind of mindset around adoption of technology or any change in healthcare for that matter. How will this benefit our patients? How will I adapt this? And then I think the key is that we've been pleasantly surprised. I think once our providers have moved into this area and realize how
Oh, Dr. Shah, speaking of technology, everyone, there is a certain thing that is a fear that we have sometimes with physicians is we're going to have an interaction, and technology is real. And so as you see now with Dr. Shah, how things have kind of disconnected here along that line. That's certainly a fear. We wouldn't want to be in an emergency situation, which I think this actually speaks to seeing this demonstration of technology, that medicine will always be a hybrid of technology and in person, because we want to make sure we take care of all aspects of care, and some things can be delivered, and sometimes there's some short circuits that we see. So I know Dr. Shah is probably getting back on. It looks like there's a question here I'm going to answer. It asks, are we still billing telemedicine by time slots given by Medicare, or now can we bill by complex medical necessity of each patient, and we are able to bill by the proper level of office visits? So that's a great question, and I will admit I'm a practicing provider, but I am not a revenue cycle CPT coding expert. So I do recommend you speak to your direct RCM and coding expert. But, in the brick and mortar, in our in-person, telemedicine is a modifier. So you need to meet the requirements of your basic E&M codes. And as we know, in 2021, they changed to aspects of medical decision-making. And if appropriate documentation does that, you can use it via the E&M code with the appropriate telemedicine modifier. If you're using the time-based codes, and that's often if it's video, if it's telephonic, right, those are time. But for those who ask those questions and really want to know how to practice and bill appropriately, I would ask you to, as I often do, consult my revenue cycle manager and my coding expertise just to make sure I'm adopting this all well. Looks like Dr. Shah is still not back in town. So let me move on and see if we've got another question here, because I want to make sure you guys everyone here has generated their time so well, and really appreciate you being here. So I want to make sure we get value of the time. There was a question out there about, how we see the balance of care delivery in the future. Someone asked, what percent is going to be face-to-face and what percent might be virtual? And I think that's the unknown question right now. And I think we need to look at other industries and we have to see the advancement of it. And I would continue on the work that we do. Looks like we're, and as we learn, and I'll reflect kind of that balance back to healthcare delivery where we, if we think about banking, right? We all used to go in to deposit our checks and then we started to take money out of the ATM. And now many people are depositing things and doing so much work mobily. So one of the things I think we can see is we can expect the train has left the station and we are moving down that path for definite a virtual healthcare delivery system, which will have a nice balance between in-person care as well as telemedicine care. I'm sorry that I'm a one-person show going back to telemedicine. Oh, listen, there's another great question here. Thanks so much. Someone asked, what hasn't been answered is telemedicine. How do you overcome the lack of physical exam? And I think that's a really important question because that speaks to both physician adoption as well as patient adoption is, we're so used to the touch and the human touch. From MD Live, we have specific telemedicine guidelines that determine, one, what could be done via telemedicine and what needs to be redirected to in-person. But the other thing is we've adopted, even without, new fancy technologies that remote in, is we've adopted things like, just helping patients almost examine themselves. Like, is your pain right below your belly button? And so there are many things that I think we can ask, and so we really need along that line to continue to advance our skills in listening and what I would call digital exams. And then it's the ultimate adoption of actually, new technologies that we see, the ability to do auto ear and being able to look in throats and those images being transmitted. So we will ultimately, really things be able to replace. So thanks for asking that question. Well, I really appreciate every time. Again, I miss Dr. Shaw talking because perhaps this is just me. Sometimes I talk to myself a lot here. And so thank you all for being here. Oh, we just had a quick question here. Well, let me ask one more question since we're still time. When do you see ENT becoming part of telemedicine? The only thing I would share from MD Live standpoint is in MD Live, we are looking to how we can expand into ultimate specialties. But I know that there are many ear, nose, and throat providers who are providing multiple virtual visits. They were doing it my previous employer at University Hospitals of Cleveland. So, ENT has some amazing ways to examine virtually, as well as to do provider-to-provider consultations. One of the telemedicine uses we had was provider-to-provider or e-consult referrals. In my previous work, we had many emergency rooms that did not have ENTs on call. And there would be some major issues with epistaxis that would often require, transfer, which is a high total cost for epistaxis and nosebleeds. And so implementing, e-referrals or e-consultations was actually able to lower, decrease and improve the cost of care. So along that line. So that, I'm going to wrap it up. I miss Dr. Shaw. I really, really think along that line. I appreciate you much for joining us, and have been really impressed with the eviCore healthcare platform and their vision, and really appreciate their time for allowing Dr. Shaw and I to connect related to kind of these barriers of telemedicine. And thanks for continuing to join us here with come join us here with MD Live, but let's all work together to really help transform healthcare through the delivery of telemedicine. So thank you again for your time. Bill, I'm turning it back to you.
Thank you, Dr. Zellis. We apologize, everybody, for a loss of connection with Dr. Shaw there, but we do appreciate you all attending today. This webinar was recorded and will be available on demand by visiting eviCore.com. Please remember to register for our upcoming webinars. You will receive an email invitation with the opportunity to do so. And thank you again to all of our panelists for sharing your expert knowledge with us today. Thank you all for your attendance and your insightful questions. This concludes our webinar. Have a great day, everyone.